Hi friends, welcome back. Today we can see a simple introduction on mycosis. Mycosis means fungal infection. Mycosis it is singular and plural is mycosis. Fungal infections are collectively known as mycosis. And these fungal infections or infections caused by fungi can affect human beings, domestic animals and even plants. And certain environmental factors, that is physiological conditions and environmental factors, are responsible for the development of fungal diseases. Mainly moisture is one important factor. In majority of people, sweating is one important problem. So this sweating, it can produce moisture, and the fungus, it can easily grow in this moisture environment, and this is the major reason for mycosis. Then other factors are also there. We will discuss it later. Then mycosis, it is also more prevalent, or the people who are more prone to these fungal infections are people taking antibiotics, the antibiotic therapy, continuous antibiotic therapy, people with weakened immune system, for example AIDS patients. Then people who are taking transplantation drugs, that is immunosuppressive drugs. Then people taking steroid treatment, then taking chemotherapy, diabetic patients, then very young people and also very old category are also at a high risk of infection. That is the more prone to fungal infections. They are more prone to fungal infections. That is once again people taking antibiotics, people having weakened immune system due to some underlying diseases such as AIDS, or due to taking AIDS, cancer, chemotherapy, then people taking immunosuppressive drugs, then steroid therapy, diabetic patients, young people, very old people, even pregnant ladies are also at high risk group, or they are involved in high risk group. That is, they are more prone to fungal infections. Different types of fungal infections or mycosis can be seen: superficial, cutaneous, subcutaneous, systemic and opportunistic. First, we can see superficial mycosis, that is mainly affecting the outermost layers of the body, mainly affecting skin, nail and hair, outermost layers. Invade only the stratum corneum, it is the outermost layer of the skin, and also some superficial layers of the skin. Some examples of superficial infections are ringworms, Piedra, Tinea Versicolor, etc. Commonly we have seen dandruff. Dandruff, it is an example for superficial mycosis. Then Piedra, it is mainly called, in Malayalam it is called kaya. It is seen in the hair shaft, and this kaya, it may be either white or black in color. That is Piedra, two types, black Piedra and white Piedra. And some causative agents are given: trichophyton, epidermophyton, microsporum, etc. are some of the important causative agents of superficial mycosis. Coming to cutaneous mycosis extends some more deeper into the epidermis and is also restricted to the keratinized layers of skin, hair and nails. Dermatophytes can again cause cutaneous mycosis, and also one important agent causing cutaneous mycosis, it is candida, causing cutaneous candidiasis. Next is subcutaneous mycosis. Subcutaneous mycosis involves the dermis, subcutaneous tissues, muscle, fascia, etc. It is chronic. It is chronic and can be initiated by a trauma, piercing trauma, or an injury to the skin which allows the fungi to enter. That is, in subcutaneous mycosis, the fungus, it is entering our body through a small trauma or an injury, and this trauma may be caused by thorn, pricks or splinter, etc. And this is mainly seen in people working outdoor, that is barefoot. They are working barefoot outdoor, mainly farmers. And so the subcutaneous mycosis, they are more seen in males when compared to female, and these infections are difficult to treat and sometimes surgeries are required, that is surgical removal is essential in some cases. Examples are Mycetoma, Rhinosporidiosis, Sporotrichosis, etc. And the causative agents, some examples are Rhinosporidium, Sporothrix, etc. Next is systemic mycosis. Systemic mycosis, here the fungal infections affecting the internal organs, the fungi that can spread through the bloodstream to multiple organs. That is, it is resulting in multiple organ failure, and it is a serious condition, eventually resulting in the death of the patient. Patients who are immunocompromised are more predisposed to systemic mycosis, And the most reliable test to confirm infections are skin biopsy analysis and fungal culture. Amphotericin B, fluconazole, itraconazole, voriconazole, etc. are used for the treatment. Candida, Aspergillus, Cryptococcus, Histoplasma are some causative agents. Candidiasis, Aspergillosis, Cryptococcosis, Histoplasmosis are some important examples of systemic infections. Next, we can see opportunistic infections. The organisms involved are cosmopolitan fungi, which are having a very low inherent virulence. That is, they are having a very low virulence, but one important peculiarity is that they can act as a pathogen when they get an opportunity. And the fungus, it results in infections in mainly patients with impaired defense mechanism. They are mainly acting as pathogens in patients with impaired defense mechanism. And this opportunistic infections, it is mainly reported, or high incidence can be seen in HIV patients, cancer patients, transplant recipients, diabetic patients, etc. And this candidiasis is one of the major important example caused by Candida albicans. Different types of candidiasis can be seen. Oral candidiasis, that is oral thrush. Oral thrush, it is mainly seen in diabetic patients and also bottle-fed babies. Then cutaneous candidiasis. Cutaneous candidiasis, one important form of cutaneous candidiasis, it is diaper candidiasis seen in babies. Then vulvovaginal candidiasis. Balanitis, it is mainly seen in male, that is, it is the candidiasis of the penis. Then mucocutaneous candidiasis can be seen. Onychomycosis, that is, onychomycosis means mainly the infection of the nail bed. Infection of the nails, that is onychomycosis. Then neonatal candidiasis can be seen, that is mainly from birth canal. The neonates will get candida from the birth canal of the mother, that is neonatal candidiasis. Then esophageal candidiasis can be seen. Ocular candidiasis, which is affecting our eyes. Gastrointestinal candidiasis, urinary candidiasis, meningitis, etc. are some important forms of candidiasis. So from this we can understand that Candida is a major causative agent which can affect various or multiple systems, resulting in opportunistic infections. Then diagnosis by microscopy, then culture, serology, etc. That's all about the introduction to mycosis. So we heard about different types of mycosis. They are mainly superficial mycosis, subcutaneous mycosis, cutaneous mycosis, systemic mycosis, and opportunistic mycosis. We can see all these mycosis in detail in next classes. Hope you all understand the session. Thank you. Have a nice day.